Hi, I'm Dr. Ahmed Hussain Pathan and you are watching my YouTube channel Surgitalks. Today I'm going to tell you about the cholecystectomy. Cholecystectomy is a procedure through which we take out the gallbladder from the human body. Gallbladder is a pear-shaped organ that is present at the inferior surface of the liver. Liver secretes the bile and gallbladder stores the bile up to 30 ml and then secretes the bile into the small intestine when a person eats or takes some oral food, and that food crosses the stomach and reaches the small intestine through the common cystic duct and the duct coming from the liver, that is the common hepatic duct. They both join to form the common bile duct, which enters the second part of the duodenum and secretes the bile into duodenum, which helps or participate in the digestive process. Why we are taking the gallbladder? Because gallbladder stresses in the gallbladder of the bile, and that creates forms the stones. So the stones can cause some complications like infection, mucocele, empyema, because sometimes stones slip down into the common bile duct and causing the obstructive jaundice. Also, the lethal complication, that is the pancreatitis, and many more complications can be occur if the gallbladder stone cannot be treated. Then, for the cholecystectomy, what happens after cholecystectomy? Because when gallbladder will be removed, the bile which is going to be stored in the gallbladder, that goes directly downwards into the second part of the duodenum and participate in the digestive process. So, after removal of the gallbladder, there will be no any definitive problems occur after cholecystectomy. That depends upon the persons. Some persons can easily resume their normal life and digestive habits on the second day or third day, but some patients or some persons after removal of the gallbladder can cause some indigestive problems they may be due to gastritis or any other cause. For the cholecystectomy, we have to prepare the patient for the surgery. Before going to surgery, we have to go for certain investigations. The investigation can be divided into two groups. One is the blood investigations, in which we see the CBC, in which we see the hemoglobin level and WBC counts and platelets. And other investigations like liver function test, virology, and other. If the patient is diabetic, then we have to check the blood sugar level and HbA1c to normalize that and prepare for the surgery. Other investigations like ultrasound abdomen to confirm the gallstones, and maybe we can go for the CT scan to rule out any other possibility. Before going to surgery, after the getting investigations, we have to take the consent from the patient and the immediate relative, and describes all the possible complications can occur during surgery or after surgery, or maybe due to the anesthesia. So we have to get the consent, describe the procedure, and then we have to proceed with the surgery. A night before surgery, patient has to stop taking orally, especially the solid foods, and but water and some other fluids can be taken, and they will be stopped 4 hours before the surgery. But if the patient is hypertensive, then the anti-hypertensive medication can be taken with sip of water on the morning of the surgery. If the patient is having any cardiac problem, and if the patient is on the blood thinning agents, then like aspirin and clopidogrel, so these medications have to be stopped 2 to 5 days before the surgery. After preparation of all the things and getting fitness from cardiology for the surgery and anesthesia purpose, and then we move the patient to the operating room. After getting anesthetized the patient and getting all antiseptic measures, then we have to start the procedure. The procedure of the cholecystectomy there are two options for the cholecystectomy. One is the open cholecystectomy and other one is the laparoscopic cholecystectomy. Nowadays laparoscopic cholecystectomy is performed everywhere because it is a minimal invasive surgical procedure. There are less scar as compared to open surgery, but if there is any problem or any adhesions or recurrent problem of the attacks of the cholecystitis, and the anatomy is difficult, so sometimes procedure can be converted into the open cholecystectomy. And in laparoscopic cholecystectomy, 4 incisions will be made in the abdomen of the patient, 2 about the 10 mm and 2 about the 5 mm. The 2 10 mm scars or incisions which will be made, one at the lower of the belly button, through which we insert a trocar, and through that trocar we connect with the carbon dioxide gas that will inflate the abdomen and create a space through which we can identify the organs, and we can do the dissection and perform the procedure. And also through that we insert the camera, which will be visualized the internal area of the abdomen. Other one is the 10 mm incision will be made at the epigastric region or the center of the upper abdomen below the chest, through which we insert the different instruments through which we can dissect or perform the surgery. Other 2 5 mm ports will be made at the right side of the abdomen. Mostly they are for the holding the gallbladder from fundus and the neck of the gallbladder. When we are inserting into the abdomen, we grasp the gallbladder. We will identify the cystic duct and cystic artery, and we clip the cystic duct and cystic artery from the gallbladder side and from the common bile duct side, and secure discontinue the continuation and stop and try to identify and apply the clip to securely and safely stop the communication. After applying the clips, we will dissect or we cut the cystic duct and cystic artery, and then with the help of diathermy we will take out the gallbladder from the liver bed, and that gallbladder will be carried out from the body through endobag from the 10 mm epigastric or upper abdomen trocar. Post-operatively, patient will be nil per orally until the patient will be comes out from the anesthesia. And painkillers or the pain medications can be given to subside the pain, and keep the patient pain free. After medication, in laparoscopic cholecystectomy, most of the time patient can go back to home on the same day or in the next morning. While in the open cholecystectomy, patient may have to stay in the hospital for a few days. During the surgery, we can also sometimes place the tube, we call it the drain tube, in the abdomen to see any possible complications can occur. So it is not necessary that complication can occur. There are 1% or maybe less than the 1% chances of complications, but we will have to take care for that. And post-operatively, after 6 hours, we will allow the patient to take orally initially liquids and then semi-solids and solids. And after getting removal of the gallbladder from the body, again I told you earlier that depends upon the patient. Some patients can comes back to their normal life and digestive habits normally, but on the safe side, we advise the patient to take small meals, avoid heavy meals which can be delayed digestible or that can cause the indigestion, oily foods, barbecue for some days or maybe some weeks. Later on, as the gastrointestinal tract comes on the routine life and the bile that is going directly towards the small intestine and can perform digestion, and that habit or that physiology can becomes onto the routine, so that patient then afterwards patient can spend the normal life as usually or as before the surgery. Even after surgery, the other advice we can advise the patient to avoid taking heavy weightlifting, because when the belly button we close with the stitches, so to prevent any herniation. If the patient get heavy weight, that can cause pressure on the incision of the belly button and then can resulting into the hernia. So to prevent that complication, we advise the patient for some time to take the heavy weight, so that until the wound get properly healed. and after that, if we apply the stitches, then that will be taken out on the 10th day. But if we apply the glue, that will be spontaneously dissolved, or the absorbable sutures, if close a wound with the absorbable sutures, they will also get absorbed, and patient can next day or after 48 hours can get bath and spend the normal life and go back to the home, like as usual, as he was or she was performing earlier. Thank you very much. Do like and subscribe my channel and share with your family and friends.